Thank you for joining us today, Dr. Kiaii. It's such a pleasure to have you on the show.
Thank you for having me. It's a pleasure to be here.
So, Dr. Kiaii, what are our kidneys? Like, how many do we have? Where are they typically located in our bodies? And what role do they play in keeping us healthy?
So we basically have two kidneys, most of us, although some people are born maybe with one kidney, but there are two kidney shaped basically organs in the back, right below where your rib cage ends, right around your spine. So that's where they're located. And they're actually extremely amazing organs because they do so many different things in terms of your health, right? So obviously the thing that most people know as the most important function of the kidney is that they filter your blood and get rid of the wastes. So that's the most important thing. But they also make sure that all your minerals and your electrolytes stay in balance. And they also make sure that you can get rid of extra salt and fluid. So they keep all that things. If you drink too much fluids, then the kidneys will make sure that they regulate that and they get rid of it. They also produce a hormone that helps your body make blood. They also make sure that your vitamin D that you get from the sun gets activated. So they do way more than what we all think that they do, which is getting rid of the waste. They're actually extremely detailed organs that they do a lot more than just that.
And how common is kidney disease or kidney damage?
So it's very interesting, Teresa, because I think that if you actually look up the statistics, I think 1 in 10 Canadians will be diagnosed with kidney disease. It'll be at different stages, but the risk is 1 in 10 Canadians actually can have kidney problems.
Why is kidney disease called a silent killer?
I love that question because the most common thing that we run into is that when we tell people, oh, I'm concerned about your kidneys because, the function's low, and they'll say, but I feel fine. Because unlike the heart, where you'll have chest pain and that tells you that you are having an issue with your heart, you don't have pain with the kidneys. The only things that really would give you pain is if you have an infection or you have a kidney stone. But otherwise, you could be losing kidney function and not feel a thing. And that's why it's so important to screen.
And so is it true then you can actually lose 80% of your kidney function before you have any type of symptoms?
Absolutely. So usually it's around 25%, 20% and below that people start to actually have the typical symptoms of kidney disease and they become aware. So before that, you could have absolutely no idea, which is very scary.
So what happens when the kidneys actually fail and stop working properly?
So as people's kidney function starts to reduce, the usual first symptoms that patients will notice is that, they're maybe developing some fluid retention, right? They're starting to get some swelling around their hands, their legs. They also start to feel less energy. So they feel like they just don't have the same energy they had before and they're not able to do the same thing. They might get less ability to do exercise. And then sometimes you start to notice that your appetites change and that food kind of starts to taste a bit funny. You might start to get a bit itchy and the people start to lose their appetite, right? So and then as it progresses more, people actually start to throw up and that kind of things. But it's usually like the appetite starts to decrease and people start to feel a bit nauseated. So lack of energy, some nausea, decrease in appetite, and maybe starting to notice that blood pressure is going up and they're starting to retain fluid. Those are usually the first symptoms that people will notice.
Wow. And what do the acronyms mean then? CKD and ESKD?
So CKD stands for chronic kidney disease, and it has, as I mentioned, different stages. So you could be considered chronic kidney disease stage 1 when you actually have 90% kidney function, but you have risk factors for progression of the kidney disease, diabetes, high blood pressure, heart disease, or you have evidence of other kidney dysfunction, which is like leaking protein in your urine. So CKD stands for chronic kidney disease, and there's 5 stages. And ESKD stands for end-stage kidney disease, and sometimes we call it ESRD, which is renal disease. But that's usually when people's kidney function is less than 15% and they're requiring dialysis.
So when should a person be concerned then about their kidney function and start really tracking with a medical team?
So usually, we like to make sure that anybody who's got a kidney function less than 30% should be under the surveillance and care of a kidney team and a kidney doctor. Usually when you're less than 20%, you need more monitoring and changing of dietary changes and restrictions, because the kidneys at around 20% and lower is not able to fine-tune things anymore. So usually that's when you need more help with the dietitian and perhaps some changes in medications, a bit more restriction with diet, etc. Usually when people are less than 15% is when we increase our monitoring significantly, because that's when you're much more at risk for further decline and requiring to actually start dialysis. Some people are sitting at 15% and are quite stable and they're monitored and their symptoms are well. We continue to monitor them, but we do like to have a plan in place by that time. And most of the time when your percentage of kidney function is less than 10%, that's when most people are required to start dialysis. It could be 8, it could be 7 for some, but less than 10, most of the time you need to start dialysis.
So you mentioned some of the risk factors there, like diabetes and heart disease. Are there other risk factors or comorbidities that are associated with kidney disease?
Very good question. So there's lots of genetic abnormalities that put people at risk. So that's one thing that we need to know, genetic hereditary conditions. Then there's immune-related conditions. So people who have an immune-related disorder of some other sort, like lupus, systemic lupus, or other inflammatory conditions that can also affect the kidney. So those things would be also risk factors to the kidney. Certain infections can also put risk factors. So people have hepatitis B or have had hepatitis C, that actually poses a risk factor to the kidneys. And then obviously there's the traditional risk factors that most other people are aware of. So high blood pressure, any kind of blood vessel disease. So that's why we always discourage smoking and making sure cholesterol is good. So blood vessel diseases, and of course the number one cause of kidney failure, people on dialysis, is diabetes still.
And are there communities or cultures that are at higher risk as well?
That's a good question. I think more and more we're understanding the genetic component of kidney disease and understanding that in certain communities or certain race or certain countries, there's more risk of certain types of kidney disease. But in my opinion, I think that people who are also more risk are people who are remote and don't have access to having screening and education. So that is something that I feel like we can maybe do something about, but there's more and more also research being done that making us understand that certain communities and certain races have more risk of certain types of kidney disease.